I'm Alan Bryce. I'm a cancer physician here at the Mayo Clinic in Phoenix, Arizona. I am the chair of the Division of Hematology and Medical Oncology, and I've been working with our colleagues in Tucson Medical Center now for a few years in terms of their cancer practice and in terms of trying to bring Mayo's expertise to the patients in Tucson.
The Mayo Clinic Care Network represents a unique way for like-minded medical centers and hospitals to collaborate, to work together in behalf of patients. In order to be an effective member of the Mayo Clinic Care Network, we need to have shared values. We recognized in Tucson Medical Center colleagues that also focus primarily on the needs of the patient.
TMC has been an institution in Tucson for generations now. They've got a long history, well-established practice, and in some ways a culture very similar to Mayo in terms of being very committed to their community and having these deep roots. The doctors at TMC are deeply invested in the Tucson community. They've been there a long time, and they've been providing high-quality care for a long time. The doctors here at Mayo come with the same philosophy.
Mayo Clinic brings a lot of strengths to the table. We bring 150 years of experience. We bring over 60,000 employees. Among them, we have about 4,500 physicians and scientists. And at any time, any one of these people could be a subject matter expert to collaborate with a member of the care network.
Our cancer team here at TMC is really close-knit and we work really well together as a team. But it's always nice to be able to confer with other colleagues that do the same thing. That's really what I like about our connection with Mayo, is that I can email the breast surgeon there and say, what would you do in this situation? And he'll get back to me within a couple hours with his experience. And the dialogue is both ways because we have different experiences. You know, he's been in Mayo for 20 years, and I've been in community practice and university practice for many years. So that ability to confer with somebody else who has a different set of experiences from you can really help me practice better medicine, but also I can turn that around and help my patient have a better experience.
I think we're very fortunate here in Southern Arizona to be a 2-hour car ride away from probably the most progressive healthcare system in the country, if not the world. So that collaboration allows us to pick up the phone if we're seeing a tough case and speak with colleagues and arrange consultations and, in many cases, jointly manage patients.
So one of the ways that Mayo and TMC work together is through this process we call e-consults, which is a platform that physicians at TMC could use to send records and ask clinical questions to physicians at Mayo. So the patient doesn't have to get in their car and travel up to Phoenix to get an opinion. The physician at TMC can reach out to us, really tell us what the quandary is, what the question that needs to be answered for the patient. And then we here at Mayo are able to review all those records, look at the scans, look at the pathology, whatever test results there might be, and feed back to the physician in Tucson. But most of the time what we find is that the e-consult really answers the question for the patient and saves them the need to come up here and spend a day traveling.
Well, I think TMC has really done an excellent job, and over the last several years, we've really built what I believe to be an excellent community-based cancer program. We have, in the last few years, incorporated 3 navigators into our cancer program. So we have nurse navigators who are focusing on providing support for patients dealing with breast cancer, gastrointestinal cancers, and lung cancers. We're excited to announce that we've recently acquired funding through the TMC Foundation to recruit a genetic counselor. Genetics is becoming an important part of how we deliver cancer care. We're recognizing that many cancers have a genetic basis.
The future of cancer care really is what we call targeted therapy, where we're looking at finding that one thing in the cancer cell that keeps it from dying, and then we make a drug to target it, and then it kills the cancer cells.
So I think with our Navigator program, our genetic counselor who's coming on board, and our special relationship with the Mayo Cancer Network, we're really building a world-class cancer program here in Tucson.